Hey peeps. So one of the most common questions that I get on social media is how to prepare for your elective rotation or your audition rotation or sub-I in Gyn Onc. And these questions are typically from medical students and residents who are assigned or have elected to do a rotation in Gyn Onc. And so I put together this PowerPoint of my opinions on how to prepare. And in knowing that, know that my opinions do not represent the opinions of all Gyn Oncs or institutions. So consider this PowerPoint to be some insight, some information that is hopefully useful, but know that everyone's different and expectations will likely be different depending on where you are and who you're with. So as far as an overview goes, we'll go over some basic information. And it's not so basic, actually. The basic information is probably the most important information. We'll go over some resources that I find to be helpful, and then some information about rounding, clinic, the OR, and then team dynamics. Okay, so I'd label this basic information because it is generalized information, but it is not basic at all. It is probably the most important information. But let's hammer down the purpose of these rotations. So it's twofold. Number one, you get more experience, you're getting exposure to the field, and maybe you're getting a letter or a grade from the rotation. And then the second one is you're helping another team. So you're getting something, but you're also giving something. It's very important to keep remembering that this is your rotation, to have the experience, to have the exposure, to try to get this letter, but also you're there to help the team. And so you should play a vital role in whatever role you're given. And the levels vary depending on kind of where you are in your training and what they want you to do. You should get some information on the rotation prior. If you don't get any information, reach out kindly to the coordinator and ask, is there information I should be receiving beforehand? And when you do get that information, read it, memorize it, read it a second time, be prepared. Typically, it'll tell you where to show up, what time. It may tell you kind of your schedule and what to expect for the schedule. I would say hopefully it tells you the dress code or how to dress on that first day. Sometimes it won't. And I would say the safe thing to do is to wear dress clothes and bring shoes. People can be kind of funny about what to wear, what you're wearing. Like oftentimes in clinic, we want you to dress up in dress clothes. And so the safer thing would be to wear dress clothes and maybe bring a pair of shoes that you could wear in the OR in your backpack. If you have a scheduling conflict, like your sister's getting married and you have to be off that weekend, please let people know ahead of time. Like as soon as you get the schedule or as soon as you have contact with someone, let people know, because you're being transparent, you're trying to work with them, and it's courteous to the person who's making the schedule and kind of adjusting it to allow you to be there, but also trying to accommodate you. Showing up on time is very important, especially in those first few days. It's respectful to be on time. And so I would suggest showing up early, especially on those first few days where you don't know where you're going. Go earlier than you think you will need to. It's okay if you have some extra time. You can kind of walk around and see the location, but don't be late, because that is your first impression is going to be important, and being late in that first impression just doesn't start anyone off on the right foot. Another thing that is maybe not intuitive, but it's to introduce yourself first. So it is your job to introduce yourself. Don't wait for someone else to introduce you. Don't wait for the attending to come introduce themselves. People are no one's thinking about you. That's not to be rude. It's just that, people are thinking about their patient. About my patient's on the operating table, and I'm not thinking who's sitting in the corner. So get up and introduce yourself and say, I'm the medical student resident here helping you today. Like, so happy to be here, Always introduce yourself and consider it your job to introduce yourself. it's never wrong. Don't interrupt anybody, but it's never wrong to introduce yourself to anyone, the attending, the scrub tech, the nurse, everyone. And also, this should go without saying, but be nice to everyone and be willing to help with anything. When you're on these rotations, sometimes your role isn't extremely well defined and you want to try to be helpful. So sometimes that's like the quote unquote scut work, or it's getting the patient a blanket or a drink or something that someone else doesn't have time for. It's calling other teams or, getting social work on the line, things like that. Things that other people might not have as much time for, but you do if you're a medical student. And similarly with residents, sometimes on these rotations, those are the helpful things too. So keep looking out for things to do and be willing to help with things. And just keep in mind, this is your rotation. Yes, you're getting a grade or a letter and you want to do well, but also, you're there. The point of these probably when they first ever started was for you to get exposure to what the field looks like in other places. So always keep that in mind. Okay, some resources that I would recommend before your rotation, but also when you're on this rotation: NCCN or the National Comprehensive Cancer Network.org, the guidelines. You can make a login for free, and they are excellent. I think anyone going on a gyno rotation should definitely have a login and be able to look things up. They're very easy to follow, and they have actually all the literature that you would need if you sift through them. But they have really nice algorithms for when you're in clinic on what to do. And so even if you're a medical student, you don't really understand exactly what they're saying, you can still kind of piece together a plan from them. And residents for sure should have these and have gone over them already. Williams Gynecology is excellent. The Gyn Onc chapters, the surgical chapters, the anatomy chapters. If you're at a university program or like an academic program, you should have free online access. Or hopefully you have the book. Maybe your program bought you the book one year. This is an excellent resource. Up to Date actually is really great for Gyn Onc. It has a lot of information, and so you should, always ask or always think what's happening the next day and be able to look these things up. Anatomy. So this Atlas of Pelvic Surgery is a website. It was made I think a long time ago, but it's still actually really, really good. So take a look at that. And then Barrack and Hacker, or just like your normal anatomy textbook. But I would definitely recommend an anatomy resource, because we don't always expect you to know everything about Gyn Onc diseases, but you should know anatomy if you're in the OR. Different disease sites. So the New England Journal of Medicine and JAMA, which I actually didn't write here, but they have these really nice review articles. So JAMA just published one on ovarian cancer. New England Journal of Medicine has one on cervix cancer and has a little bit older one on endometrial cancer, but is still pretty relevant. Those are great. There's no vulvar one, so maybe I'll put a vulvar one in the comments that I like. And then Williams, again, is really nice. And then there are different YouTube resources. I'm hoping that my YouTube can be a resource for you as I post more videos. And if you go back, I've done cervix, I've done endometrial cancer. And so definitely listening to those on 2x speed, good resource. Okay, so you're definitely going to be rounding on these rotations, and you will likely be one of the first people to round in the morning. And so give yourself plenty of time. I think rounding is not that hard, but oftentimes you can run out of time, either formulating your plan or getting your presentation ready. And so, you're on this rotation for a month, and it's like a 1 month sacrifice that you kind of need to make on any elective, not just Gyn Onc, on any elective, because you're trying to put your best foot forward. And so give yourself plenty of time in the morning. Waking up early really stinks, but doing a really good job on these presentations feels really good. And so you want to have time to to see your patient, to look things up if you need to, and come up with a sound assessment and plan. Have your presentations organized. And so the other thing is that like oftentimes like we're so focused on our own presentation that you don't listen to anyone around you. But when you're like a medical student or a resident and other people are presenting, like you should be listening to them, because typically the format they're using is the format you should be using, and the abbreviations and the way they pronounce things. And you can learn so much from other people's presentations. So although, yes, you're focusing on yours, if you give yourself plenty of time, then you shouldn't need any extra time to focus on yours, and listen to other people's presentations and try to learn from them. And then another one is get your notes done timely. So you should have enough time to have those notes done, pended, sent to the resident or fellow or attending before the day starts. And so be sure that that is done on time, because nobody wants to wait for those till the end of the day. It doesn't look good. Okay, you're definitely also going to be going to clinic. And so we already talked about dress code. The safest thing is usually to dress nicely, or like business casual, unless told otherwise. Or you can always ask, what do I wear to clinic? I personally like for medical students and residents to wear white coats. If it's available, if you have them, I wear a white coat. I just think they look nice, but I'm also okay with scrubs. So I think everyone varies. I know other people who want everybody to dress up nice. So the night before, look up the patients prior to the clinic. And if it's your role, or if you can, start those notes. I actually think that starting the notes and formulating the notes is really helpful for coming up with a plan. And so go through the patient's history, know why they're coming, usually if they have like a new complaint based on the notes, and then you can formulate a plan. And if you already have it in the note, you're really setting yourself up for success. Be prepared for questions. So if you don't know something about the topic or the disease site that patient has, look it up. Always be interested and enthusiastic. I think that this is one of the most important things kind of in my mind, because I think you can teach someone facts, but you can't really teach someone to be interested and enthusiastic about things. And so, like we said in the beginning, you're there to learn, and you're there to learn as much as possible. So be interested in what's going on, be enthusiastic about learning, and being there to help. And then ask questions. If you don't understand something, or it's maybe a topic that you're not as familiar with, don't be afraid to ask questions. You're there to learn. And in the long run, no one's gonna, people might remember you, but to an extent. So don't feel silly asking questions. Ask away. All right, and then the OR. You'll definitely be going to the OR if you're on a Gyn Onc rotation. Anatomy is key. There are plenty of resources. Know the case beforehand and where you think you're going to be operating, and brush up on your anatomy. And before you go, try to have your program quiz you and ask you questions of what are the most relevant questions to be asked. If that's something that we could always do an anatomy lecture. That might be something that would be a good idea. Prepare the night before for the case. You should know the patient's history, know the diagnosis, know the procedure, know why they're having the surgery done. There's no excuse for not knowing this information. So I always like to think if my family member was having surgery and the people that I'm working with don't know why, don't know what we're doing, why we're here, the diagnosis, things about it, I think that's very disrespectful, especially because you're not the surgeon. You're there to learn. And so you need to put in every effort to respect the patient and why they're there. And you need to know these things. Obviously, you're not going to know everything, but to know the history, things that you could easily look up in the chart, you need to know those. And then being respectful to the OR staff. You're the guest in the OR. And so always be willing to help, always be kind and nice. We already talked about kind of doing some of the smaller things for the team. It goes a long way, I think, helping move the patient, And then trying to anticipate like the next steps in the OR. So once you've been in the OR once or twice with someone, you kind of know like, oh, this is how they position the patient. This is what they like. So you can kind of start trying to do those things. You can always ask permission, like, can I do that? Or sometimes, like, I'm still asking the anesthesiologist, like, can I go get the bed? Because there's always room for respect in the OR. So be helpful and know your stuff. And then team dynamics. I personally think that this is more important than what you know. That's just me, because I think that how you treat people says a lot about you, who you are as a person, and whether or not someone might want you on their team. And like I said, I think that facts can be taught. So always be willing to help. A lot of teams have nurse practitioners and PAs, and so always be asking them like how you can help. If you like are a resident, then help the student, and vice versa. Being enthusiastic, we already talked about that. Having a positive attitude, I think goes a long way, especially like on these like long grueling days or in the OR for so long. Someone having a negative attitude just is kind of a bummer. So I don't know. That's me. Trying to have a positive attitude. You're only there for 1 month. You're there to learn. And then I've said this a couple times, but it's 1 month that you are trying to learn as much as you can, but you're also trying to impress the people around you, and you're trying to put your best foot forward. And so be willing to go above and beyond for the month. Kind of have that mindset when you're going in. Be willing to work really hard for that 1 month to not only help the team, but to learn as much as you can, because the harder you work, the more you're going to learn and the more you're going to get out of this rotation. So, it helps not only the team that you're on, but it really helps you. Other random things, sometimes where you're at, they'll have like research going on or like other projects that you can get involved with. Ask if there's anything going on. Ask if there's anything you can help with. If someone asks you like, hey, we have this like journal club or this drug rep dinner, or there's a case going this weekend, do you want to help? Just say yes. I mean, as long as you don't have something else more important going on. Like, showing up, networking, showing that you're interested, doing these things, it'll be beneficial to you, and you'll get to know other people, and you'll get to know them in a setting that isn't the regular setting, and it might be really, really nice. And then ask for feedback, because you never really know how you're doing. Don't ask for feedback every single day, but like maybe midway through your rotation, ask for feedback, and be willing to accept it and like improve on it if they give you some like constructive criticism or like something you can improve on. I think you should do this on any rotation, not just an elective rotation, but it's really important on an elective because you're not going back with these people again. So you have this 1 month to impress people and show them that you know what you're doing. And like asking for feedback is a nice way to, number one, correct anything that you might be doing wrong. And number two, show that you can accept feedback and implement it. Whew, okay, that was a lot. But all that to say, I still want you to have a lot of fun. These the people who message me are really stressed and anxious, and I was too when I went on my elective rotation. I went to Memorial Sloan Kettering. It was very, very anxious when I was going, and it was fantastic. I had a blast. I had an amazing team. I met some amazing people, and I just think that if you go in with a positive attitude, you go in ready to learn and help and work your butt off for a month, you almost can't go wrong. Almost. You can probably mess it up in some way, but remember that you're there to learn and to get exposure to the field. And I think that's why a lot of people go, yeah, you get a grade, but I really wanted to go because my home institution didn't have a fellowship. So I wanted to see what Gyn Onc was going to be like at an institution that is the number one in the country for Gyn Onc. And you are there to learn just as much as you're getting evaluated. So try to remember that. Try to remember. I'm happy to answer any questions. And like I said, these are my opinions. Other people probably have stronger opinions. But I think this is a good baseline, but happy to answer any questions in the comments or messaging, and good luck. I think that if you take this advice, you'll be great.